Hi, welcome to Doc LQJ Speaks. I'm LaQuanda Jefferson, your wonderful, lovely host. I'm a psychotherapist here in the Atlanta area. Definitively speaking, a psychotherapist is a person with a strong psychological educational background who employs psychologically, empirically grounded principles to therapy or talk therapy with their clients to remit change in their lives. And that's what we do. That's what I do as a quality life coach. I make sure that I'm alongside my clients 100%, and I'm rooting them in a very, very positive way, stern way, and I hold them accountable for their change in their lives and for their discovery of self and anything that may be impeding their their propensity to fulfill and accomplish um, those things within them that demonstrate growth ultimately. So the topic for this month, November, is going to be awareness surrounding borderline personality disorder. There are a lot of people in America who suffer from mental health issues, and then because there is this huge stigma associated with getting help, talking to someone, we have to be really creative in the way that we help people. And I feel essentially like the people who are in the helping profession are not here for the money. We're here for the improvement of the quality of life of our fellow American citizens, because essentially we're all systemically connected. And that connectivity makes us as a country stronger. So about 1 in 5 Americans suffer from some type of mental illness. That number may be even higher because we have so many people suffering from mental illness and mental instabilities, and they simply will not um, submit to evaluation or treatment. It is my aspiration to change that. Is to remove that stigma, because the people who are out here suffering from various mental illnesses or disorders are not the ones who are bad per se. Those are the people who are trying to improve their quality of life. Those are the people who want to be great, who want to achieve autonomy, who want to continue to contribute to society in a positive way, in a positive light. And essentially, that takes so much strength and it takes so much courage that the majority of us can't even access that piece of us. So, back to the topic, borderline personality disorder, commonly referred to as BPD, is a condition that is characterized by difficulties that one may have regulating their emotions. This difficulty may often lead to severe mood swings, instability, impulsivity, and um, very unstable personal relationships for people. Sometimes we see very, very low self-esteem in the individuals suffering from borderline personality disorder. But we know that people with borderline personality disorder, they make over and over and over again, they make attempts to create these secure bonds, but they suffer from abandonment issues. Um, Ultimately, we characterize it by the emotional turmoil that a person goes through. And it's it's so it's so difficult to really understand what that person is going through because they've had some significant traumas in their lives that inform the way that they deal maladaptively with their emotions. Um, the treatment modality of dialectical behavioral therapy is a treatment method that was actually created for people with BPD. I am a guru when it comes to DBT. I have several manuals. I've written like several um, personal manuals and skills workshop workbooks for my clients, and I've helped so many people in so many ways with a wide array of mental illnesses and emotional disorders deal with the stress and, you know, regulate their emotions in a whole new light using dialectical behavioral therapy. This is a very effective treatment. I found it to be extremely helpful with the clients that I've, you know, used it on over the course of my graduate program, and even thereafter with lots of my life coaching clients. Like, it's just, it's an all around better way of living for people who struggle with emotional regulation or distress management, period. So that's great. Some of the symptoms that people with borderline personality disorder have is distorted and unstable self-image, which affects their moods, their values, their opinions, their insights, their relationships, and their goals in life. The impulsive behavior, and it can definitely be dangerous. So you may see them engage in risky activity often. Suicidal and self-harming behavior. They have frantic efforts to avoid being in those situations where they have no one. So they don't want to be in situations where they have to be abandoned. So they're struggling to make these connections, and these connections continue to fail, and they have very unstable connections because they're unstable themselves. You may also see that they devalue people, which is why a lot of those relationships meet their demise. So these are some of, you know, the key symptoms. Normally, people with borderline personality disorder may have like 4 to 5 out of the 9 major symptoms. What I see oftentimes is the anxiety and depression, kind of like moods of high depressive or manic depressive episodes. That's what I see a lot in those BPD clients. But there's lots of information on the APA, or American Psychological Association's website, about BPD. Also, the National Alliance on Mental Illness, NAMI. They have lots of information. What's not known is ultimately the causality of BPD is kind of like up in the air, but most scientists and practitioners do agree that there's a combination of brain functionality that may contribute to it, genetic factors, and social or environmental factors that influence people who are diagnosed with this mental illness. So all I would like to say is that if you find someone who needs the help and you can see that clearly, they're suffering from some or all of these symptoms that I've named, or even the information that you may access in your own personal research, because I always, you know, push people to go out there and learn what they can learn and do their own research and find, you know, the facts, because of course the things that I highlight are the things that I see commonly, but that doesn't limit, you know, the symptom list, because there are so many symptoms associated with BPD, and it's lots of ways that you can recognize it. But what I like for people to do is to elevate themselves, educate yourself, and elevate yourself so that you have an advanced knowledge about what you may or may not be dealing with. You know, if a person has BPD, the way you can help is to encourage them to see someone, talk to someone that's a professional, because you're going to get an unbiased and outside opinion of what you're going through, and that could be helpful for anyone. That's a way for you to say it. And work to do everything that you can to destigmatize the association of, you know, that stigmatic look or that negative view on psychotherapy, life coaching, counseling, and that kind of thing. Because, you know, here's the thing. In America, we like to think that we are the land of the free and the home of the brave. And that's not true if we put ourselves in a box and limit our options when it comes to the help that we need emotionally, to remain emotionally and mentally sound. Okay. So moving on to the relationship topic of the day. This particular topic was selected so randomly because we did have quite a few of them. And I may even do another one later on in the week. But I do have a lot going on in the month of November. I'm trying to transition to do a lot of other things. But briefly, it says, my child's mother has recently left me for another man. She took my daughter with her, and we're going to call this guy Danny. She took my daughter with her and left a note about how she felt things were great, but she needed more. My question for you is, how do I continue the relationship with my 4-year-old daughter without dealing with the frustration of her leaving and having a stranger around our child? Okay. Well, Danny, I can't stress enough how important communication is. I talk about communication all the time because I really feel like essentially the majority of our issues in life boil down to that one common factor across the board. We as people have to learn how to do those basic things that we've gotten away from. Communicating is everything. And if you are not getting what you need out of a relationship, you should probably be communicating that directly with your partner, to your partner, prior to leaving. And there are probably many signs before she left and you just simply didn't notice them. However, people are not mind readers. And on her part, maybe she could have done a much better job at communicating these things to you. So what I would suggest is that you have a fluid conversation with her about maybe going and getting some professional help, sitting with a psychotherapist, kind of like just to sort out the issues and discern where you guys are transitioning as far as the relationship, and establish a solid co-parenting plan, because essentially children need both parents. And it'll be great if you guys could co-parent, and create a safe and healthy environment for your daughter to grow up in. And I do strongly feel that when parents are dating other people and those other people become an integral part of the children's lives, both parents need to know that individual, because you never know what could happen and when. And trust is huge in this particular equation. Maybe if you guys sit down and have a fluid conversation, she'd be more apt to have you meet this person once you've gotten to an emotionally sound place to where you're able to deal with the breakup in itself and this whole life transition for you. I'd definitely be talking to her about regular visitation and access to your daughter, because that's what's important. Just remember to not negatively talk about or devalue your I should say your prior significant other, but the other co-parent. Those are the only particular insights that I have for you. That's my buy-in, and I really hope that it works out. Oftentimes, people find themselves in relationships that will transition multiple times, because we start off as friends many times, and then we move into the relationship that is an intimate partner type. And then we moved into the relationship that is no longer an intimate partner type, but back into a friendship, barely friendship, because we decided to separate, part, and go our own ways. That particular relationship may involve co-parenting sometimes, and sometimes it doesn't if children weren't born of that relationship or their marriage. But what is important is communication. You have to stay like eye to eye when it comes to the communication piece. So, I like to keep it short and simple. And that's pretty much all I've got today. You guys take care of one another, love one another, and push to destigmatize mental and emotional health and wellness. That's pretty much all I've got. You guys have a great day.